Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, I'm Aleyda Pradhana. I'm a medical student of Universitas Islam Sultan Agung Semarang. So today I want to explain about Consort 2010 checklist of information to include when reporting a randomized trial. So the title of the article is Outcomes with Intragastric Balloon Therapy in BMI less than 35 non-morbid obesity. 10-year follow-up study of an RCT. So the first checklist is number 1A. The number 1A is identification as a randomized trial in the title. So we can see in the title if there is a word RCT, so we can the number 1A is available. Second is number 1B. The number 1B is structured summary of trial design methods, result, and conclusion for specific guidance. See Consort for abstract. So number 1B, we can see in the abstract. So there is a point purpose, materials and methods, result, and conclusion. So the number 1B is available. The next is number 2A. The number 2A is scientific background and explanation of rationale. So number 2A is we can see in the introduction. So in the introduction, we can see all of the text from the introduction is the scientific background. So number 2A is available. Number 2A is the rise in the prevalence of overweight until we can see in here is an ASEAN cohort. Next is number 2B. The number 2B is specific objective or hypothesis. The number 2B, we can see the last paragraph in here. So this study present outcome with long-term follow-up of this RCT to evaluate the long-term efficacy for IGB. So number 2B is available. Next is number 3B. So the number 3B, the number 3A. So the number 3A we can see in materials and methods. For the first sentences, a prospective double-blinded randomized controlled trial RCT conducted in 2006 until 2008. So the number 3A is description of trial design such as parallel factorial including allocation ratio. So number 3A is available. Next is number 3B. The number 3B is important changes to methods after trial commencement, such as eligibility criteria with the reason. The number 3B, we cannot find it in this article. So number 3B is not available. Next is number 4A. The number 4A is eligibility criteria for the participants. So number 4A, we can see in the materials and methods. This is inclusion criteria where patient aged 18 until 16 years and then the exclusion 2 until the breastfeeding is the number 4A. So the number 4A is available. Next is number 4B. The number 4B is settings and location where the data were collected. We cannot find in this article, so the number 4B is not available. Next is number 5. The number 5 is the intervention for each group with sufficient details to allow replication, including how and when they were actually administered. So we can see in this materials and method, patient in the IGP arm underwent placement of Orbera, Apollo, and Dorsarchip TX USA IGP, filling with 500 milli and place pupil for a single 6-month period. SIP U39 arm received diagnostic sham endoscopy and commenced at 10 mg SIP ultramin daily for 4 weeks and then 15 mg daily for a total duration of 6 months only. So we can conclude that the number 5 is available. Next is number 6A. The number 6A is completely defined pre-specific primary and secondary outcome measures, including how and when they were assessed. We can see in these materials and method 2, the number 6A, primary outcomes were changes in weight, report as total body weight loss, presented TWL, and change in BMI. Secondary outcomes were the development of new diabetes mellitus and other comorbidities and patient willingness for further intervention. Institutional review board approves this study. So number 6A, we can conclude that it is available. Next is number 6B. The number 6B is any changes to trial outcomes after trial comments with reasons. We cannot find it in this article, so number 6B is not available. Next is number 7A. The number 7A is how sample size was determined. The number 7A is not available. Number 7B, when applicable, explanation of any interim analysis and stopping guidelines. The number 7B is not available. Next is number 8A, method used to generate the random allocation sequence. The number 8A is not available. Next is number 8B, type of randomization details any restrictions such as blocking and block size. The number 8B is not available. Next is number 9, mechanism used to implement the random allocation sequence such as sequentially number container, describing any steps taken to conceal the sequence until intervention were assigned. The number 9 is not available. Next is number 10, who generated the random allocation sequence, who enrolled participant, and who assigned participant to intervention. The number 10 is not available. Next is number 11A. So on the number 11A is if done, who was blinded after assignment to intervention. For example, participant, care provider, those assessing outcomes, and how. We can see number 11A is in here. A prospective double-blinded randomized controlled trial RCT. So the number 19A is available. Next is number 11B. The number 11B we can see in here. If relevant, description of the similarity of intervention. So we can see in these sentences, multidisciplinary lifestyle modification advice is provided to both groups. All patients received education on balanced 50 carbohydrate, 60% fats, and 20% proteins. Hypocaloric diet. All patients were encouraged to achieve target physical activity of at least moderate activity such as walking, jogging, or cycling for at least 30 minutes daily for 5 days per week. The multidisciplinary team review all patients at all follow-up. So the number 11B is available. Next is number 12. Next is the number 12A. The number 12A we can see in here, statistical methods used to compare group for primary and secondary outcomes. We can see in here, statistical analysis were performed using IBM SPSS Statistics for Windows version 25.0, IBM Corp release 2017, Armonk, NY IBM Corp. Continuous variable were presented as mean, standard deviation, and categorical data as number percentage. Comparative analysis performed by t-test, chi-square, two-way repeated measure ANOVA, and Mann-Whitney U-test were applied. A p-value of the less 0.05 was considered statistically significant. Next, so the number 12A is available. Next is number 12B. The number 12B is methods for additional analysis such as subgroup, Analyzed and HS analyzed. We cannot find it in this article, so the number 12B is not available. Next is number 13A. The number 13A is for each group the number of participants who were randomly assigned, received intended treatment, and were analyzed for the primary outcome. We can see the number 13A is in the results. So the number 13A is available. Next is number 13B. The number 13B is for each group losses and exclusion after randomization together with reason. We can see in here, follow-up review at 10 years was deemed inappropriate for 2 patients that underwent laparoscopic sleeve gastrectomy, IGB group, and 2 patients developed advanced malignancy control group. So the number 13B is available. Next is number 14A. The number 14A the number 14A is for each group, losses and exclusion after randomization together with reason. Wait a minute. Oh, I'm sorry. My fault. It's number 14A. It's dates defining the periods of recruitment and follow-up. So the number 14A is actually in here. So it's actually not in the results, but we can see the recruitment and the dates of the periods recruitment is conducted in 2006 until 2008. Okay, next is number 14B. The number 14B is not available in this article. Next is number 15. The number 15, a table showing baseline demographic and clinical characteristics for each group. We can see in the table, this table is the number 15. Next is number 16. The number 16 is for each group number of participant denominator included in each analysis and whether the analysis was by original assigned group. So the number 16 is not available. The number 17 for each primary and secondary outcome result for each group and the estimated effect size and its precision. So the number 17A is this one, the table 2. Next is number 17B. The number 17B is for binary outcomes. Presentation of both absolute and relative effect size is recommended. The number 17B is not in this article, so the number 17B is not available. Next is number 18. The number 18 is result of any other analysis performed, including subgroup analysis and HS analysis, distinguishing pre-specific from exploratory. The number 18 is not available. The number 19. All important harms or unintended effect in each group. The number 19 is not available. Next is number 20. The number 20 is trial limitation addressing sources of potential bias, imprecision, and if relevant, multiplicity of analysis. This sentences small patient number due to the sample size requirement of the initial study requirement protocol and the response rate despite the long-term nature of the follow-up are notable limitation. So the number 20 is available. Next is number 21. The number 21 is generalizability, external validity, applicability of the trial findings. We cannot find in this article, so number 21 is not available. Next is number 22. The number 22 is interpretation consistent with results, balancing benefit and harms, and considering other relevant evidence. we can see in here. However, the potential benefit of IGB before bariatric metabolic surgery, even as pre-operative adjust to bariatric surgery in class 3 obesity population. So the number 22 is available. Next is number 23. Next is number 23. The number 23 is registration, number of name of trial registry. We cannot find it in this article, so it's not available. The number 24. The number 24. Wait a minute. The number 24 is where the full trial protocol can be accessed if available. So this appointment for the initial trial was registered on clinical trial. This the number 24 is available. The last is number 25. Sources of funding and other support such as supply of drugs, role of funders. The number 25 is not available. So that's all for me. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.